What are the strengths of the healthcare sector? Number one, the size. It's 10-11% of GDP, and that varies by country. Japan is at 8. The US is north of 15, for instance, and the rest of the countries we have on the slides are about at 10, 11. I couldn't get the numbers for China, actually, because the source of those are OECD numbers. So it's big. 10% is big. And second, it's growing faster than the overall economy. And it's also defensive. So it's less cyclical than the overall economy. Those are the first strengths. Then we've got a strong demand. We all know about demographics. We've got aging population. We've got life expectancies that are increasing. And also we've got risk factors, alcohol, tobacco. We've got the rise of chronic diseases such as diabetes and respiratory. And so the demand is growing. And also the demand is growing, and you've got technological innovation, medical innovation that enables you to have treatment today you could not have in the past. So you have to do your analysis when you invest in healthcare real estate. What is the equipment rate? What is the rent coverage? So basically, how much of the cash flow is the operator paying to me as an investor, and how much is he keeping for his own profitability? That's very important when you do your analysis. And then it's still real estate, so if at the end of the lease there's a probability that the tenant is going to leave the building, conversion scenarios might be interesting to envisage a second life for these buildings.
If you look at this slide, I'm sure that just based on the first line of the slide, we could have probably a lot of candidates which would like to be involved in this sector. But bear in mind also that there are also the two other lines which point out the fact that it's a very sophisticated market in which you have to know where the main actors play, what the plan, the state plan would be in terms of authorization, in terms of geography for the future. So you have to know this sector very well to be able to be efficient. If not, I'm afraid that you can probably bet on the bad actors and probably lose a lot of money. So it's definitely an attractive world, but once more with high barriers at the entry.
There is no doubt, as we can hear, that there will be a great need for investments in this sector. But to spur this discussion further, whether it is a safe investment or not, I think it's interesting to raise this point of view and also the questions about the healthcare in the future, how this should be planned. We have for a very long time witnessed the trend of how hospitals tend to become more cities within the cities. They have poor relation with their urban context, and the planning of hospitals have mostly been focused around optimizing the internal functions such as logistics, improved accessibility for ambulances, streamlined treatments, process, and so on and so on.
German hospital market is sort of a different kind of animal to invest in healthcare real estate. The private operators in German hospital markets refinance themselves when they are looking, they're always buying OpCo and PropCo, meaning real estate and operating company together, and they refinance themselves with 3-4%, so they don't need to pay 7 or 8% in rent to real estate investors. We have something which was introduced in, I think, 1991 called the solidarity tax. That was when the wall came down and Germany got reunited again. And we're writing the year 2012. Our solidarity tax is still there. I mean, 20 years later. So once a tax in Germany is being introduced, and I think in your countries it might be the same, it won't go away. So we have the nursing home care insurance program, which every German has to pay in currently about 2.2% of your gross salary goes into this fund, which accounts for about 50% of the revenues in the skilled nursing sector. And I think this is an interesting figure. About 30% of the residents in skilled nursing facilities in Germany are welfare recipients.
So what makes senior housing unique to China as opposed to other Asian countries? I've highlighted four main points. The first being the one-child policy, and that's really changing the landscape in China more so than in other Asian countries. In all the countries in Asia, it's tradition that the family cares for their elders. Now, when you only have one child as opposed to several children, the responsibility and the burden falls on the shoulders of that one person as opposed to sharing that with maybe 3 or 4 brothers and sisters as is common in other Asian countries. So that alone, that one factor alone is going to be a major driver for why senior housing is going to come out of necessity. The second is the aging population. This is really rapidly aging in China. The percent of population over 60, and that's the senior sector, is forecast to triple between now and 2050. That in a numerical, just to give you perspective, that's growing at a rate of 8 million a year. And as a result, there's just a huge supply and demand imbalance because there's been very little private sector investment into this field. Families are now more and more displaced because the son or daughter leaves their third-tier city or rural district and moves to a larger tier 1 or 2-tier city for greater career advancement, higher education, and basically to live their life. Right now we're at about 50-50 in terms of urban population versus rural population, and that trend is only going to continue. So families are separated. The son or daughter will move away, create their own family, create their career, and then the time comes when their parents become of age where they need some more medical attention. And at that point, the son or daughter is in most cases, not able to quit their job and leave their family or move their family back to where their parents are to take care of them. As a result, they move their parents closer to them. So what we're looking to invest in and develop are service departments, especially catering to seniors that are designed with seniors in mind, that have clinics integrated, that have 24-hour nurses on hand, generally independent living seniors, and that create a sense of community for these seniors as opposed to the first two options. Now, that could be done through fitness courses and anything from nutrition classes to shopping outings to calligraphy. And these sort of activities don't exist in China. They don't exist within housing, senior housing complexes. So this is going to change the perception of senior housing in China from where it is today as a very negative stereotype to something that is quite nice. And we are attempting to improve the quality of life and improve the lifestyle of these seniors.
We are overaging, but we're also cost-driven. And if you look at the prices hospital, if you stay a day in a hospital, it's running you anywhere between 500 and 700 euros in Germany. If you stay a day in the rehabilitation clinic, you're looking at between 180 to 250 euros a day, roughly. And then if you're looking at the lowest cost or the cost leader, which is care, we're looking at 100 euros a day, roughly, give or take 10%. Now, if you look at the German healthcare cost, and now comes care into place, the average length of stay is still around 9 days. So the Germans are lying longer in bed than anybody else, quote unquote. And so we have to haul them out of bed earlier, and here comes into play the skilled care part. And therefore, I think the classical nursing home will be, so we have to reduce the average length of stay in the hospital, and we have to provide a higher level of care, medical care in the nursing home, which is the cost leader. And I think this will be the future.